everyone, welcome back to my channel. So today we are going to make a video about GCS scoring system. So what we do in the OSCE with assessment in is the first part, right? Assessment station. And in this assessment station you are going to do the observations, plus you will include the GCS score. So let's begin. So first of all, you will check for the scene safety. Scene is safe, patient privacy is maintained by drawing the curtains, and then you will start your hand hygiene. You will perform your hand hygiene and you will state all the process involved and let the hands dry for 30 seconds. After doing that, you need to do the introduction. You are going to introduce yourself and explain the purpose of nursing encounter and gain the consent. After that, you need to check the patient ID, ask their full name, date of birth and hospital number, and double check it with the ID and the notes you have there. Okay, and then after that you are going to check ask the patient like what is the reason of the visit, or if they are in the community setting, you can tell them that you can ask them like why they are there in the community setting. After that, you need to ask the patient like check for the cues also. You can check on the table if there is a pack of cigarettes or water or anything like that. It will give you an idea about their lifestyle. And then you are going to ask the patient if they are comfortable, if they are in any pain or sickness, or if they need hearing aid or eyeglass. So you always need to check that before starting the procedure. Then when you are going to do the observations, so you need to check your BP apparatus and thermoscan. Check for the, you can state the functionality and the if it's clean, or so you can just say that I will check for the next test due date, and I will check also if it's functional and it's well cleaned before the use. And then you'll explain the procedure to the patient, like I'm going to check your observations, which include your blood pressure, temperature, pulse, respiration, and your oxygen saturation levels. And then you can also tell that because GCS we usually do with the patient with subdural hematoma, so you are going to tell the patient if they have had any fall or any head injury. Then you can tell them, since you have had a fall, so we are going to do your neurological observations also. Okay, so this is the way you are going to explain the procedure to the patient. After that, you are going to start with the blood pressure. Check if the patient is comfortable before starting again. And you can ask the patient like which arm they want you to use for blood pressure checking, and also state that you have taken appropriate size of the cuff, BP cuff. And then you can ask the patient which arm I can use for your blood pressure, and then assess the arm if there is any if they have had any operation on that arm, and if fistulas are there. So, and then you are going to tell the patient that it may squeeze your arm when I check your blood pressure, so don't worry about that, it will be there only for a few seconds. And also when you check temperature, you need to tell the patient that you will hear a beep sound in your ear, don't worry about that. And one more thing, before checking temperature, you need to ask the patient if they have any hearing aid. And remember, if they have a hearing aid, you need to take it off for 10 minutes before you check the temperature. Okay, remember that. And then for the pulse and respiration, you need to complete 2 minutes. But since you will not have a real actor in this exam, so you can just assume that I've been check the pulse and respiration. Just pretend that you are checking and say that I will assume that it's already been 2 minutes. I have completed 1 minute for your pulse and 1 minute for your respiration. This is the way you are going to tell the patient. And then for oxygen saturation, you will ask the patient again, which finger do you want me to use? Check for the capillary refill, check if they have any false nails, any nail polish or something like that. Then before checking the oxygen saturation, then you can check it. After doing all this, you can tell the patient that give me few minutes, I'm just going to document it. You can document here or at the end of taking GCS score. You can do it together if you want to, but keep an eye on the time, because this is a long procedure and then you will have only 12 minutes. So be very careful. After doing this general observations, normal observation, you are going to do the GCS. So for GCS, you need to check if the patient is opening and closing their eyes spontaneously. So if you will be seeing the examiner, right, you can just have a look and tell the examiner that as I can see the patient is opening, or I will check for the eye opening, if they are opening their eyes spontaneously, opening or closing their eyes spontaneously, then you will give a score according to that. And then you will ask for the verbal, check for the verbal response. Verbal response means you are going to ask the patient a few questions, 2 or 3 questions. You can ask their full name, their date of birth, or you can ask them where they are. If they answer you correctly, then means they are oriented. But if they are confused in these questions, you can see that all right, thank you so much. Make sure you don't give any score at this point, because at the end of the exam, at the end of the assessment, examiner will give you the scores. So you are not, you don't know, right, what scores you are going to get from the examiner. So don't tell anything. You can just say that okay, I've checked your verbal response, I'm gonna give you a score for that. Then you are going to check the best motor response. You can ask the patient like can you please hold my hand, and then ask them to squeeze it. If they are able to do that, which means it means that they are okay, they are they are obeying your commands, which is good. So you will give the score according to that. After that, you are going to check their pupil reaction and their size. So you have to tell the patient that can you please look at a particular point for me on the ceiling, and then I will be flashing some light into your eye. And I know that it's not comfortable, but it will be there only for few seconds, yeah. And I will flashing the light from outer to inner canthus. Okay, and then you will check for the size and reaction. If they are reactive to the light, if they are reactive to the light, you are going to write plus. If they are not reactive, then you are going to write minus. So if there is no reaction, yeah. And then you need to check the size also. You will be provided with the pen light, so you can see the size of the pupil from there. And then at the end, you can say that the last bit, I have to check your limb movement. For limb movement, you can ask the patient like for the arms, you can ask them, can you flex your arms for me? If they are able to do that, very good. And then after flexing, you can ask them, can you lift your arm up or something like that, just to check the power in their arms. And then, or else you can ask them, I will be pushing your arms and then you need to resist me, and then I will be pulling your arms, you need to resist me. If they are able to do that, very good. And then you could then same thing you will do for their legs. You can ask them, can you please flex your knees for me? And if they are able to do that, very good. And then you can ask them, I'll be pushing, you need to resist me, I'll be pulling, you need to resist me. And then you will give the score according to that. So guys, be very careful about the timing here. With the GCS and OBS, you have a lot of things to do in 12 minutes, okay. And I will just do it the GCS only. I will just like to explain it again how you are going to do it in the exam. So you can say that as I can see you are opening closing your eyes spontaneously, so I will give you a score according to that. And then you can ask them, do you know where do you live, and where are you in the where are you right now? So 2 or 3 questions are enough. You won't have enough time, so don't ask too many questions, okay. After that, you can ask them like, hold my hand, squeeze it and squeeze it tight, lift your arm up. So if they are obeying command, that's very good. So for the pupil size and reaction, I've already told you. Limb power also I've already told you. So at the end of that you can tell the patient, okay, thank you so much, we are done with observations, can you please give me few minutes and I will just document your readings and then I will get back to you. And then make sure you maintain hand hygiene throughout the procedure, and whenever you touch the patient and do the observations in between, make sure you do the hand hygiene. And then in that writing section, like when you document, make sure you document everything each and correct. Assessor will give you the readings, or if they don't give, ask them, assessor, can I please have my readings? Yeah, and then they will give the reading. Then you start writing. Make sure that you practice it, because in the exam you will not have time to find it out where you are going to write. Just read it quickly and document it. Documentation is most important. Yeah, if you don't document it, it means you haven't done it. So be very careful with the documentation. And that's it for today. For the observations is the normal ones as we do, and the GCS, it takes time, so practice it every day. Practice makes a man perfect. So you can do it with the time limits. Yeah, and that's it for now. If you have any questions, if you want me to document GCS on the GCS chart, neurological observation chart, I can do it. I can make another video for that. Please do let me know, and good luck for you who have exam on Monday, this coming Monday. Good luck for all of you. 19th of April, good luck. Wish you very best of luck. And practice it, practice. Yeah, if you have any questions before your exam, please do let me know. I'll try my best to answer your all queries. Thank you so much. Take care. God bless you. Have a happy weekend.